Good morning, everyone. I'm so sorry for the technical glitch. I apologize and thank you for the patience. I will be talking on medulloepithelioma of the ciliary body, enucleation versus conservation. We have no conflicts of interest to declare. So basically, the patients often present to us with leukocoria, somewhat like this kind of a presentation. And we are often told that the differentials are congenital cataract, retinoblastoma, Coats disease, and the list goes on. But nobody ever speaks to us about medulloepithelioma, and yes, it is quite an important differential of leukocoria. It is a rare, non-hereditary neoplasm of childhood arising from the primitive medullary epithelium, mostly involving the ciliary body. 75 to 90% of the tumors present in the first decade, and it is often misdiagnosed, as I just mentioned. The treatment includes cryotherapy, plaque brachytherapy, external beam radiotherapy, local resection, enucleation. And local tumor resection has 50% recurrence in these cases. And as per literature, enucleation is often required as primary or secondary. So eventually, if you're going for the radical approach, we thought, why not look for a conservative approach? So we went to the literature. As per the literature, chemotherapy has been attempted in 2 of these studies, but it has been highlighted in a very important review of literature that the role of systemic chemotherapy is not yet well established and it remains to be further explored. So we thought, why not? Let's explore. And as we had to take all the cases, we went ahead and conducted a retrospective interventional case series of 19 eyes of 19 patients with clinically confirmed medulloepithelioma, biopsy proven, treatment naive eyes. And exclusion criteria was baseline metastasis or loss to follow-up. We saw that the median age was 24 months, the range was 1 month to 66 years, and only 2 were referred with correct diagnosis, and I hope you understand the highlight and the importance of this sentence. The patients presented mostly with leukocoria, 63%. Neovascularization of iris was seen in 53%, secondary glaucoma, vascularized lateral membrane was seen in 26%, and anterior chamber mass, which is like quite evident in the second picture as you can see over here, was seen in 21% cases, and lens subluxation is quite an important one because the tumor pushes the lens aside and therefore it causes subluxation. Ultrasound biomicroscopy plays a very key role over here because you can see intratumoral irregular cystic areas, and in our study we saw basal diameter of maximum 16 and basal thickness of maximum 8 mm. So medulloepithelioma treatment is basically divided in these subsections, and I'll be taking them one by one. So we observed one of the cases which was basically a tumor which was less than 6 clock hours, and in fact it was only in 1 clock hour and the patient is doing well even now. In the cases which were surgical intervention, fine needle aspiration biopsy plays a key role, which we did in 42% of the cases, which showed pseudostratified primitive neuroepithelial cells surrounded by hyaluronic acid-rich hypocellular stroma. And immunohistochemistry also plays a very important role in confirmation of these diseases. So primary enucleation was also done in our cases, 53% cases. But these were the cases which had extensive involvement, more than 6 clock hours, neovascular glaucoma. And these patients were mostly teratoid or non-teratoid, benign or malignant, based on the Zimmerman et al. Criteria. And 2 cases received adjuvant radiotherapy. These are the ones with scleral invasion and extraocular extension. So now comes to the conservative part, and that is 37%. And it's not a very small number when we look at the cases with less than 6 hours involvement. So here you can see 78% were still treated conservatively with chemotherapy with vincristine, etoposide, carboplatin, and cyclophosphamide combination. And 2 of these cases required secondary plaque brachytherapy. So you can see over here that post-chemo, the tumor has responded very well. So we can actually contradict and go back in time and say that yes, the tumor does respond to chemotherapy, and with plaque, we are kind of ensuring that it does not come back. And over here, we have seen excellent results. The next part is plaque brachytherapy, which has also shown excellent results in less than 6 hours. And with all of these things put together, we can say that 100% eye salvage can occur in these cases with no local tumor recurrence or systemic metastasis at a very long follow-up as seen over here. So in our study, we can say that secondary enucleation was not done in any of the cases. We were able to achieve conservative management in the cases which were less than 6 clock hours involvement with complete 100% live salvage. So to conclude, it's a rare non-hereditary neoplasm with arising from primitive medullary epithelium, presents in first decade. Look for intratumoral cysts. Cystopathological diagnosis is advocated. Timely, accurate diagnosis is important. Regional and distant spread can be avoided. Scleral invasion, if present, can be dealt with adjuvant radiotherapy, and conservative management is what we advocate with primary chemotherapy and secondary and primary plaque brachytherapy in cases which have less than 6 clock hours involvement. So thank you very much for your patience. The most common misdiagnosis, sir, was retinoblastoma.
So the message is you should also consider medulloblastoma in case of white reflex.
Yes, sir. And it can be dealt with conservative management as well, because in earlier times it was directly taken up for enucleation, so we can provide globe salvage and vision salvage in these cases.
What is the longest follow-up of patients who are on conservative management?
So in the longest follow-up, we have had 12 years.
Thank you.
The case which is having 12 years of follow-up is like,
Sorry,
what is
sir.
the outcome to that patient?
The vision salvage is there,
Vision
sir.
salvage
Yeah,
is
yes,
there.
sir.
There is no recurrence.
No.
Thank you. Good.
Since you asked what is the most common differential, most of these patients usually present as pediatric glaucoma, because this is a tumor which is hidden near the ciliary body. They often present with pediatric glaucoma, increase in intraocular pressure, mostly misdiagnosed and not diagnosed as a lesion sitting in the ciliary body. And they have this front of vessels which goes as a sheath behind the intraocular lens. Unfortunately, most of these patients undergo trabeculectomy and trabeculotomy. First, intraocular procedures are very, very common in medulloepithelioma. So seeing the sheath of vessel, we have to always look for something hiding inside the ciliary body, and UBM is the best to help you.
That's why IC, even in cases of IC, where the anterior chamber is little uneven, one need to do the UBM. Right. Just to get feel something is not wrong behind.
Yes, absolutely.
Thank you for your inputs and good cases.